Welcome everyone. We are going to do a 20 question pharmacology practice quiz all about cardiac medications. If you guys are interested, please join Kahoot. We're going to do cardiac medications. The IRS joined. Nice. Welcome everyone. We're going to do 20 cardiac pharmacology practice questions. We'll probably start in like 5 minutes. So we'll let some people join in and then we will get started. We'll have 20 questions all on cardiac meds. Hello, West Coast, Flo, Brendan, Alicia, Willow, welcome. Everyone, we're going to do 20 cardiac pharmacology questions, quiz questions. All right, we're going to start in about 5 minutes. Let some people join in. All cardiac medications. Welcome Tia, welcome Elizabeth. If you guys want to do 20 cardiac quiz questions, jump into the Kahoot. If you can't get into it right now, you'll be able to join at any point while we are doing the quiz. It's going to remain unlocked. So Ashanti, Daniela, Kate, welcome. Okay, are you guys in pharmacology? Are you guys taking your NCLEX? Let me know where you guys are at. I'm always curious to see where everyone is. Graduate in May. Okay, so you're close. So you probably did pharmacology already at the beginning of your program. Are you in a BSN program? Tara, I'm taking pharmacology. Nice. How do you like it so far? For LVN, graduate in May. Okay. So you're taking pharmacology and you graduate in May. So they do it later. A lot of May graduates. Okay. So then I feel like you guys are in like a traditional program, right? Where you take like the full 2 years. I feel like the accelerated ones graduate at kind of random times. Been a nurse for 5 months already, just bored and trying to refresh my memory. Wonderful. Welcome. Always good for a little refresher. Okay, we'll give it 1 more minute and then we'll get started. All right. How did you guys like pharmacology when you guys took it? Do you guys remember everything? Do you feel like You're going to be confident in it for the NCLEX, or definitely going to need to study a little bit? How often do you do this? I was kind of doing it randomly, but I just set up a schedule. I put it in my bio, but I'm going to try to be live Mondays, Tuesdays, and Thursdays. So cardiac, I'll probably carry this over into next week and do one of those lives with this same quiz. And then I'm going to fill out some like drug cards and do like a little lecture for the other ones. So we'll definitely have a new Kahoot every week. I did nervous system earlier in the week. This coming next week, we're doing cardiac now. And then I'll do another class of meds. I'll be there. Thank you, King. Okay. All right, let's get started. Each question has 60 seconds, so you guys should have time. Again, if you're trying to join in or you get kicked out, you will be able to join back in. It's an open game. And the game pin, again, is, hopefully you guys can see this little box. The game pin is right there, right there in that little picture. Also in that little box are just all the resources I have for pharmacology students. If you guys need practice tests, medication templates, if you guys are required to do that for your school. I have a course on how to study for pharmacology, and I do some one-on-one tutoring. I have 2 spots available right now for tutoring if you guys are interested. Can you guys read that okay, the question? You can see the screen. Yeah, Kahoot is great. I love Kahoot too. I used this at teaching with like a lot of my students. Kuroshi, no, you can't. What part of the screen can't you see? Is it just hard to read, or you need me to move it back and forth? No, can't see. Uh-oh. That looks okay. All right. I can see. Okay. A couple of people said they could see. All right. So 18 of you chose the correct answer. An RN is administering digoxin to a client with heart failure. Which assessment finding requires immediate intervention? Yes, you guys are correct. A serum potassium of 2.9. Right? So that's going to be hypokalemia. When we have hypokalemia, it's going to increase the risk of digoxin toxicity. Do we know why, though? Do we know why hypokalemia causes an increased risk? All right. What happens is they compete for the same receptors, right? So if we have less potassium, that means more digoxin is going to be allowed to bind. More binding digoxin is going to lead to increased risk of toxicity. Okay, so that is why hypokalemia is a risk for increased, or it increases the risk of digoxin toxicity. Remember, they compete for the binding sites. All right.
Can you turn the brightness up on your computer, maybe?
I did. I turned it bright all the way. Rosie in our top spot. Is it just hard to see read the question at the top?
The wording on the top's a little small, yeah.
I'll have to fix it for next time. Can you read the question? Yes. A client receiving a continuous IV infusion of nitroglycerin reports a headache. What is the nurse's best response? You guys can also, I believe, go to Kahoot, get the app, and then put in the game pin there, and then you guys will be able to play it on the app, which might be easier. I'll have to figure out a way to make these questions better. This is only my second time doing this. Stop the infusion immediately. Someone thinks blue. What is the name of the app, please? It's called Kahoot. 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 I see a little bit of everything. Stop the infusion. Call the provider. All right, our correct answer is administer PRN acetaminophen. So nitroglycerin, this medication causes vasodilation, right? It's going to release that nitric acid. And overall, what this is going to do is it's going to decrease that myocardial oxygen demand through the vasodilation that it causes. However, headache is a common side effect, right? There's going to be some cerebral vasodilation as well. Your patients will have a headache. Well, they won't, it's not guaranteed, but it's a common side effect. This is not going to indicate toxicity or an emergency, right? So we can give them Tylenol. That's totally fine. Haley taking our number 1 spot. Headache is address the pain. Yep. I think someone said Mavela without an order from the doctor. I think there you are kind of overthinking the question a little bit. I know in some cases, like if they aren't specifying, like you don't have an order, you can assume that any medications that they are suggesting you might give potentially could have an order, unless they're asking you about like contraindications, okay? It's really easy to sometimes kind of overthink these questions because they almost make it that way. And so then we kind of think deeper and then we overthink them a little bit. I see a lot of blue. Oh, let me read this for you. Sorry, guys. Well, questions pretty much. I'll read the next one. Sorry, I forgot. All right. 33 of you chose I should eat more green leafy vegetables. An RN is educating a client taking warfarin for AFib. Which statement by the client indicates a need for further teaching, right? So we're looking for the incorrect statement that will then be the correct answer. Green leafy vegetables are high in vitamin K, right? This is going to decrease the effectiveness of warfarin. And the key here is that our patients need to take a consistent amount of vitamin K, and then we can base a dosing based off of our anticipated vitamin K intake, right? But we don't want them to take warfarin and then go increase their vitamin K. Does that make sense? And yes, the green leafy greens are high in vitamin K. And vitamin K is the antidote for warfarin. All right, let me know where you guys are at in pharmacology. If you go to settings in the corner, it should let you show Q&A on player devices. Oh, I don't think I can get out of this now that I've already started. Oh, here. Oh, here we go. Thank you for that. Okay, hopefully that helped you guys. If you guys are using your own device or you have the Kahoot app. Okay, a client taking atorvastatin reports muscle pain and weakness. What should the nurse do first? 21 of you chose check our CK levels. That is correct. So we have to recognize atorvastatin is an HMG-CoA reductase, right? We're thinking it's our statin. They have a beautiful ending to them. All the meds end in statin. Okay. Anyways, what these meds are going to do is they're going to reduce cholesterol synthesis. One thing they can do, though, is they can cause myopathy. And in severe cases, that can end up being rhabdomyolysis. Ultimately, what is happening is it's muscle breakdown, right? And when we have those large cells that get released into the bloodstream from muscle breakdown, that can then lead to kidney damage, right? So these elevated CK levels are going to confirm potential muscle injury. All right. V, holding the top spot. Excellent job. A client prescribed amiodarone for ventricular arrhythmias should be monitored for which serious adverse effect? So amiodarone for ventricular arrhythmias. I see red, I see yellow, red. This is fun and genius. Good, Megan, I'm glad you're liking it. Blue, yellow. All right, we have 3 people who chose the correct answer. Let's talk about this. So, amiodarone, this is a potassium channel blocker that prolongs that repolarization phase, right? Of that, it's the cardiac action potential. Anyways, it has a long half-life and can accumulate in the tissues. And ultimately, it can accumulate in the lungs, causing pulmonary fibrosis, which will manifest as our shortness of breath, a cough. It can show infiltrations on a chest x-rays. So patients who are taking this need to have regular pulmonary function tests. Guys, amiodarone is one of those meds I always recommend when you study pharmacology, study as a class, right? Learn beta blockers all at once, learn ACE inhibitors, learn statins. And then there are some meds with some weird side effects. Amiodarone is one of them. It has a lot of kind of weird side effects to it. So this would be a med that you would make like a drug card for individually. In addition to, making your drug cards for just classes, some drugs are going to get their own drug card because they have these kind of random side effects and specifics that you need to know. This is one of those drugs. V, good job holding that top spot. Okay, let me go back and look at some of our comments, see if I missed anything. Anybody else in prerequisites playing? Good. That's excellent because then you won't see this for the first time, right? You'll see these medications and it won't be brand new. I always suggest everyone starts looking at, all this stuff before they get to class, before they get to the lecture. If you go in blind to pharmacology and you have no idea what your instructor is going to talk about, it's going to be very challenging for you to be active and engaged in lecture. Cardiac farm test tomorrow morning. This will be a good review then. All right, I see some reds. Mostly reds here. I'm using Kahoot. You can go to kahoot.it and enter the game pin. You can also download the app. All right, so 35 of you chose correctly. Furosemide. What is furosemide? Throw it into the comments. What is furosemide? What class is it in? Click the wrong answer. A loop diuretic. Yes. Rosie, Brooke. Okay, perfect. Yes, it's a loop diuretic. It's one of the stronger diuretics that we have. But anyways, it's going to increase the urinary excretion of magnesium, right? So 1.5 is kind of our cutoff, right, for hypomagnesia. Anyways, if we have this low magnesium, it can lead to ventricular dysrhythmias, which could ultimately lead to lethal dysrhythmias like that torsades de pointes. So we need this to stabilize cardiac cell membranes, prevent arrhythmias. So anyways, furosemide is going to increase that urinary excretion of magnesium. A big philosophy of mine when teaching pharmacology is, V, good job, you're still in first, is making sure that you guys understand why, not just memorizing, that furosemide can increase, urinary excretion of magnesium, but understanding more of the why and breaking it down. Don't just memorize. Okay. You have any material for Theory 1? Theory 1, that's like a class in your nursing program, like nursing theory, you mean? Yes. So I really focus mostly on pharmacology. I have resources for pharmacology. I don't know a lot about kind of what's covered in like nursing theory. I'm sure it's more of like, I feel like it's more of like a writing class. My experience in teaching, I taught health assessment, pediatrics, and then mostly pharmacology. So I do have some resources for pharmacology when you get there, but unfortunately I don't know without talking to you like how that would translate to nursing theory. All right, a client taking an ACE inhibitor develops a persistent dry cough. What should the nurse do? You'll notice in this question, it's not even telling us a specific med. It's just giving us kind of a general class, okay? So our correct answer here is C29. If you got that correct, notify the provider for a possible medication change. ACE inhibitors, a common one you'll see is lisinopril. ACE inhibitors have that ending of pril. They're going to block that conversion of angiotensin 1 to angiotensin 2. But what happens here is it will lead to a bradykinin accumulation, and that can then trigger this persistent dry cough. You can switch to an ARB if this is bothering the patient or if they have that. So yes, someone just said it. Won't they switch to ARBs? Bianca, where do I sign up for tutoring? If you go to the link in my bio, it'll come up and you'll see like the practice tests, the medication template, and there will be one that says one-on-one tutoring. Click on that and then you just sign up, and then I will message you back and we can talk about what you need tutoring on. ARBs. ARBs are angiotensin receptor blockers. Can you try an anatomy quiz? I do have some kind of anatomy-esque questions in some of my other quizzes. Let me go next quickly and then I'll read the comments. When do you do lives? I'm doing lives Mondays, Tuesdays, and Thursdays at 8 p.m. Mountain Standard Time. Will you be going over diuretics? So we have diuretics, and here's one, in this quiz, and then I'll probably do a lecture and like fill out a drug template for my other lives next week. We're going to do just all cardiac meds next week, and then the week after that, we'll switch it up. I did all nervous system drugs last week. So, but I can definitely think about doing some diuretics in the next 2 lives. Also check out my videos. I just did a video for somebody, who asked for a comparison of diuretics. If you guys ever have a med you want me to go over, you can always leave a comment on one of my videos and my posts like, hey, can you talk about diuretics or loop diuretics? And I'll make you a video based off your requests. So thank you. This is awesome. Good. I'm glad this is helping. Okay. I was looking at all the comments. Let me find where we're at. Which of the following statements by a client taking spironolactone indicates a need for further teaching? So again, we're looking for the wrong answer, which is going to be our correct answer. I should increase my fluid intake. Okay. So spironolactone is a potassium-sparing diuretic. It is more of a weaker diuretic than like our thiazides and our loop diuretics. Anyways, this medication inhibits aldosterone. It doesn't cause excessive fluid loss, so increasing that fluid intake is going to be pretty unnecessary. And then another education we want is they should avoid potassium-rich foods and salt substitutes to prevent hyperkalemia. Rosie, taking that #1 spot. Excellent job. Looking over these. I'm a pharmacy student and this is so helpful. Good. I'm glad this is helping you guys out. You'll have to let me know how you feel about the questions. Are they challenging? Are they easy for you guys? What do you guys think? I tried to do a mix, questions that test your, basic foundation, asking you just facts. And then I tried to get some more of these critical thinking NCLEX style questions. Very challenging. Okay, good, good. We always love a challenge. Hopefully you come here and you get all your challenging questions, and then by the time you take a pharm test, they'll be, easy. You'll be like, oh yeah, these aren't even as hard as the ones I saw on TikTok. All right. Okay, 8 of you chose C, worsening heart failure. A client receiving dobutamine for heart failure should be monitored for which adverse effect? Dobutamine is a beta-1 agonist. Okay, so this is going to increase contractility and cardiac output. So our clients with severe heart failure, right? It can increase myocardial oxygen demand, worsening symptoms. Okay, so it's going to worsen potentially this heart failure. All right, let me move on. How often do you do this? I am trying to do these 3 times a week, Mondays, Tuesdays, and Thursdays. This coming week, we're going to be doing all cardiac meds. So I'll probably be doing this same quiz on another live one of those days. And then we'll be doing a lecture and filling out some drug templates. So if you guys, a couple of you I saw are doing cardiac, so that's good. Got any tips on how to study for pharm? I have lots of tips, Jay. In fact, I made a whole digital course on how to study for pharmacology. A couple things that I would do is, sorry, I got lost in the comments here. A couple things I would do is make sure that you're looking at your notes prior to showing up to lecture. You have to be engaged. You really need to know how to understand what is important to patient safety and patient education. And then you have to be able to identify that in the question. What is the question asking? And my personal favorite way for students to study is to be teaching it out loud. So get a whiteboard, get a large poster board, and start teaching it to the wall, your dog, a family member, whatever. Teaching, I think, is the best way to reinforce information. So, all right, RN is about to administer propranolol to a client with hypertension. Which condition requires immediate intervention? Yes, you guys, 28 of you chose the correct answer, which is asthma. So propranolol is a non-selective beta blocker that blocks beta-2 receptors in the lungs, causing bronchoconstriction. Okay, so overall what this can do is worsen asthma symptoms and lead to respiratory distress. Okay, so our cardioselective beta blockers are preferred with our clients with asthma. How many questions are in the game? There are 20. If dobutamine helps with heart failure, how can it worsen heart failure? Well, it can increase that myocardial oxygen demand, and then it can ultimately worsen symptoms of heart failure. Oh, sorry. I forgot to hit next. I'm seeing some greens, which is like D. A couple blues. All right, the correct, oh, we had a split here, blue and green. Let's talk about this. So, clonidine. Okay, so clonidine is a centrally acting alpha-2 agonist. Okay, so what is that medication going to do? It's going to reduce sympathetic outflow, lowering blood pressure. Okay. Hold on, sorry, I lost my train of thought here. I was reading the comments too much, seeing them. Anyways, with these medications, abrupt withdrawal, what can happen? We can have rebound hypertension, and that can lead to stroke or hypertensive crisis, right? Clients should never be abruptly stopping this. We need to gradually taper these medications, okay? Sorry, I'm trying to keep up with I'll get better at doing these lives. It's my second time. It's a lot. I have to look at what question we're on and what the right answer is, and then provide you guys rationales and read the comments all at once. My multitasking is getting tested here. Do you have flashcards on your website? I don't have flashcards. I actually have a study guide that will probably be coming out in about a month. So keep an eye out for that. I'm just doing the final touches on it. But what I have on my website is listed in this little white box here. So 175 practice tests, a blank medication template, and a digital course, and then one-on-one tutoring is available as well. This one is a little, well, I'll tell you after the right answer, or after the question answers pop up. All right. Okay, good. Most of you got it right. I should call 911 if chest pain is not relieved after the first dose. I will tell you, as a pharmacology professor, I have taught in a couple different places, and we've used different textbooks, and some resources will tell you after the second dose, and some will tell you after the first dose. However, in the educator material I have used with both ATI and HESI, I have found that the questions actually want them calling 911 after the first dose. So if you have heard if it's after the second dose, you're not completely wrong. I have seen that in textbooks and resources. So if you guys have seen that in your textbook, don't panic. But what I've seen in test questions, though, always call after that first dose. But anyways, nitroglycerin is a vasodilator. It reduces that myocardial oxygen demand. And then if it's not relieved after one dose, it may indicate an MI. And then that is the need for immediate medical intervention. I want to join. The game pin is 2269506. Meanwhile, in a clinical setting, we say after the third. Yeah, sitting down is technically it. It's kind of, it also, the question said, hold on, which one? Look, going back to number 12. Yeah, sitting down. It said correct understanding, yeah, so. All right, good. 36 of you chose A, or heart rate of 50. That's correct. A nurse is administering diltiazem to a client with atrial fibrillation. Which assessment finding is most concerning? What drug class is diltiazem in? Any of you guys know what drug class this? Yep, calcium channel blockers. Absolutely. So calcium channel blockers are going to reduce the heart rate, and reducing myocardial contractility. Bradycardia can indicate excessive drug effects requiring a potential dose adjustment, right? We're not going to be giving a medication like this that lowers the heart rate if the heart rate is below 60. Oops. Do you have any resources on antibiotics? Kayla, yes, I have a bunch of videos on antibiotics on my page. I do one-on-one tutoring if that's something that you need help with, like individually and specifically about those meds. There are antibiotics and antiviral section in the practice test. So each section has 25 questions. There's cardiac, GI, but antibiotics and antivirals is one of them. And then I do have a study guide coming out, which will have it as well. But right now, the best thing would be maybe grab the practice test if you want some practice questions. And then we could always do some tutoring and then check out my TikTok page for videos explaining that. What can I expect in a one-on-one tutoring session? It depends on what you need. So if you want to talk about like kind of what you're struggling with and how to study, we can talk all about that and how you can move forward successfully. If you have a test, like a cardiac test, you tell me what you want and I will come prepared with practice questions, case studies, or maybe we just need to go over slides and learn. It's really kind of tailored to you. So I have a lot of content and resources that I can bring for pretty much any section of pharm that you're in. And we'll have a conversation beforehand. So you're not just showing up and we're going to figure it out as we go. I'll have a plan prior to our tutoring session. And you can let me know if like, oh yeah, that sounds good. I need practice questions, case studies, things like that. All right, a nurse is monitoring a client receiving heparin therapy. Which lab value requires intervention? Yes, 34 of you got this correct, an APTT of 90 seconds. So heparin prolongs that activated partial thromboplastin time, APTT. That therapeutic range is typically 60 to 80 seconds, depending. Anyways, level of 90 is probably too high and it's going to increase a bleeding risk. We're going to need to adjust that dose. I want to book for my HESI, need practice questions. Well, if you want just practice questions, there's a 175 question practice test at the link in my bio. That would be great as well. So that's another option for you. It's $9.99. So if you want practice questions, they are available. I'm seeing yellows, red, a blue. Okay, a little bit of everything here. How much is tutoring? It is $75 an hour. And that's because I do a lot of prep for each tutoring session. I don't just kind of show up. Like I said, I really try to make it as beneficial. So I come with case studies, practice questions, stuff like that. All right, a client taking furosemide reports muscle cramps. Which electrolyte imbalance should the nurse suspect? 32 of you got this correct. Hypokalemia. So furosemide, we think we talked about this earlier, is a loop diuretic. It increases the excretion of potassium, which then will lead to hypokalemia. So we need to watch out for muscle cramps, weakness, and arrhythmias. Yes, potassium depleting, potassium wasting. Yep. Do you post these somewhere? No, the ones here I kind of reserve for my lives, so they're not available outside of these lives. But like I said, these questions will be very similar to what are in the practice test. What's the link for this quiz? You can go to kahoot.it and enter the game pin. Kahoot also has an app, and then you can enter the game pin there. Seeing blue, yellow. You should post these on YouTube. I do have a YouTube channel. That's probably something I should do actually. But I do have a YouTube channel with a couple different longer format style lectures on there. So if you guys want the longer style lectures, they'll be on YouTube. How often do I go live? I'm doing Mondays, Tuesdays, and Thursdays at 8 p.m. Mountain Standard Time. What's your YouTube? My handle, Pharmacology for Nurses, is the same all across everything: Instagram, TikTok, and YouTube. Okay, an RN is preparing to administer adenosine to a patient experiencing SVT. What is the appropriate administration technique? 26 of you got this correct. Give as a rapid IV push followed by saline flush. Yes, absolutely. So adenosine is an antiarrhythmic that works by temporarily blocking that conduction through the AV node. Okay. You'll hear it called, like, it's effectively resetting the heart in cases of this SVT. It has a really short half-life, about 10 seconds or less. So you have to really slam it in through the IV, and then you do follow it immediately by a saline flush. The purpose of that is so that it reaches the heart before it's metabolized. If you give it too slowly, it's not going to be effective. Has a half-life of 1.5 to 6 seconds. Yeah, exactly. That's definitely more specific. That's good. Short half-life. And a prayer, yes. Rosie holding that top spot. Good job. Love this for everyone, but few brought back some nursing school PTSD. Is that the one that stops the heart? Yes, it essentially kind of resets the heart. You guys have seen this. I have not seen this. I've never seen it. Adenosine. My background, besides teaching, like as an educator, clinically is in like the NICU and labor and delivery. And then I went and I've been teaching in schools, again, health assessment, pharm, and pediatrics and OB. So I've never seen adenosine given in the clinical setting. Seeing a lot of blues, red. Do you recommend doing med surg before NICU or LOD? No. If you know what you want to do, go into whatever you want. Don't wait around to do med surg. I had the privilege of being able to live with my parents. So after I graduated nursing school, and I was just like, I'm not going into anything unless it's like maternal child health. So I luckily got into a float position right as a new grad where I did labor and delivery, pediatrics, NICU, and postpartum. And I think if you know exactly what you want, go into that. If you are someone who doesn't know, med-surg then might be a great option because you can get a lot of foundation in a med-surg and then you can kind of branch out from there. So, but if you're like for sure, like I was, like I don't want to do anything besides this, then just go into it if you can. They're also very competitive to get in there. But a patient taking hydralazine for hypertension develops a butterfly-shaped rash across the face. What should the nurse expect or suspect? 41 of you got this correct. Systemic lupus erythematis, SLE-like reaction. Anyways, it is a direct-acting vasodilator. So we use it to lower blood pressure. We relax that vascular smooth muscle. In long-term use, though, it can trigger this lupus-like syndrome. Systemic lupus, I don't know how to pronounce erythematis. It's not spelled normally. Anyways, it's characterized by a facial rash, joint pain, fever, and fatigue. It's essentially an autoimmune response, right? So if they see this, then you will discontinue. You'll discontinue the med. Rosie, good job. It can cause a flare. Didn't know that. Interesting. Does anyone have trouble pronouncing these drug names? I always, even in my videos that I still record, you'll always see like a cut right before the drug names because I have to like listen to it, like how to pronounce these drug names so I'm saying them correctly. Pronunciation is like probably the biggest thing I struggle with when it comes to, teaching this material. Let's see. Do you have questions for pathophysiology, HESI, or any referral? I don't. There is someone who does, he's like, it's called the A&P professor on TikTok, and he has some anatomy and physiology questions on there. Like he does little quizzes, and he probably has some resources. It's called the A&P professor, I think. I try to talk and I try to incorporate a lot of pathophysiology into like even my tutoring or my little TikTok videos because I think it's so important to understand, not memorize. So we want to know how these drugs are working. But I don't have anything specific, like if you weren't comparing it to a medication. Okay, an RN is reviewing the morning lab results of a client taking enoxaparin. Which finding requires immediate intervention? 36 of you chose the correct answer, which is a platelet count of 90. So this is a low molecular weight heparin, okay? So it's going to inhibit factor XA. It's going to reduce clot formation. However, you can have a major adverse effect, which is heparin-induced thrombocytopenia, HIT. Anyways, when you have this, it's the immune system attacking the platelets, leading to a drop in the platelet count. Okay. And then you actually end up having the opposite effect, and it increases clotting risk. But anyways, a low platelet count could, when they're on this medication, could suggest a possible heparin-induced thrombocytopenia. So we would immediately discontinue this. Platelet count is low. Yes. How often do I have these? I go live Mondays, Tuesdays, and Thursdays. As of this week, this is only my second time going live. So that's the schedule I'm going to stick with. You'll probably see, if you guys join me for next week, you'll probably see this quiz again. And then I do like a little lecture with slides. And then I have medication templates that are available at the link in my bio, but I fill those out on the live so people can see how I fill those out. Do I have a YouTube? Yes, I do have a YouTube, and it is the same handle for Instagram, TikTok, and YouTube. Valerie, good luck tomorrow. Oh, I must have missed Valerie's comment. Good luck on whatever you are doing tomorrow. You're going to kill it. I see some people kind of rationalizing it. I love that, thinking about it. All right, a nurse is monitoring a client started on milrinone, I think I'm pronouncing that one wrong too, for acute decompensated heart failure. Which assessment finding is most concerning? Yes, A, 50 of you got that correct. Guys, if you don't know anything about this drug, you know that the blood pressure is an issue, right? So if you guys, and I talk about this in my course, if you guys know nothing, like how do you find what the answer is? If there is a patient safety or if there is a vital sign out of whack, then yes, that's probably going to be your biggest patient safety. You need to address that as a nurse. So if you knew nothing about this, then you would know blood pressure is a concern. But anyways, this medication is a phosphodiesterase inhibitor. It increases cyclic AMP. Essentially what that is going to do is it's going to enhance that myocardial contractility and vasodilation. It's going to improve cardiac output in severe heart failure, but it also lowers systemic vascular resistance, and it can lead to hypotension. So this is what I was talking about, is I like to understand the pathophysiology behind every drug. I don't like to just memorize. I don't like my students to just memorize. I think everyone needs to understand how these drugs work, and it's going to help you connect the dots, understanding why we give it for certain indications, why we have the side effects that we do. Typically, it's too much of a good thing. And then why that leads to our nursing considerations. Please never memorize these drugs. So it's going to reduce that systemic vascular resistance, causing hypotension. So that blood pressure is dropping pretty good. Our cutoff is typically 90/60, right? That's kind of like that guideline. So we're going to need to stop the medication or change the dose. Carrie, thank you for the heart. This is my second time doing the kahoots, and I think my third or fourth time going live overall. I don't quite know the gifts, but I so appreciate them. If you guys have sent them, thank you so much for all the support, even just being here. I really appreciate it. Hopefully you guys found this very helpful. All right, our final question. I had to abbreviate some of these as I copied them into Kahoot because there's a character limit on there. So hopefully the number 4 doesn't throw you guys off too much. While you guys are finishing up with this question, again, I so appreciate everyone coming into my live and doing these. I will be live Mondays, Tuesdays, and Thursdays around 8 p.m. Mountain Standard Time. We'll do this cardiac, and I have a theme for each week. So all next week will be cardiac. So we'll do probably this same quiz again on a live. We'll talk about some drug templates and fill those in and do a lecture. So if that's of interest to you, check it out. Also, please go to the link in my bio if any of these resources are of interest to you. I think they would be a great help. I have 175 question practice tests. It's broken down into different categories. So GI, cardiac, respiratory, and that way you can take them with where you're at. They're not intermingled. So you can take your cardiac quiz questions when you're studying cardiac. You can take your GI when you're studying GI. So that's only $9.99. The medication templates you'll see on my lives, there's 75. My live will end. There's 75 pre-populated blank medication templates. So where is the quiz? The practice test is going to be at the link in my bio. Same with the blank medication template, and then a digital course. It takes about 40 minutes to complete, and it's just about how to study for pharmacology and all my recommendation. So, and then I also do one-on-one tutoring if that's of interest to you. So, Anyways, an RN is educating a patient on doxazocin for hypertension and BPH. Which statement by the patient indicates a need for further teaching? So 28 of you chose the correct answer here. I should avoid grapefruit juice while taking the medication. Doxazocin is an alpha-1 adrenergic blocker. Okay, so it's going to relax the vascular smooth muscle to lower blood pressure and relax the smooth muscle in the bladder, neck, and prostate. Anyways, this is going to improve our urine flow in BPH, but it doesn't interact with grapefruit juice. Okay, it can cause orthostatic hypotension, especially after the first dose, and we want our patients to take it at bedtime to minimize that risk of dizziness and falls. Okay, indicates the need for further teaching. So our wrong statement is our correct answer. So our podium here, we have V, Coco, and our first place is Rosie. Excellent job, guys. All right, thank you guys so much for showing up. Again, I do, oh, Valerie, V is me. Good job. I do videos like on my TikTok for meds specifically too. That's like totally free. So if you guys have any meds you're studying and you want a little TikTok video on it, let me know and I'll tag you in my post too. You can just comment on any of my videos and then I'll put it on my list, and it helps me kind of like even create content, and then it helps you guys too. So if you have any meds you want videos on, if you can't like do tutoring or something like that, that's also another way to kind of get some info. And also DM me. I'm always happy to answer a question, you know. My live schedule is at the link in my bio as well, but it's going to be Mondays, Tuesdays, and Thursdays. And I always have a theme for the week. So all next week is going to be cardiac. So you will see this quiz one more time. I'll do a lecture, and then I do some drug templates for cardiac meds as well. I go live at 8 p.m. Mountain Standard Time for those lives. And then sometimes I randomly jump on live throughout the week as well. I have a newborn, so sometimes it's kind of hard. You probably heard him in the background. I start pharmacology next week, currently an LPN nursing program. All right, you're going to do great. I have a whole course on how to study for pharmacology, but some tips right here are to make sure you're prepared for lecture. Never go into lecture not having been familiar with the information. The best way I tell you to study that content is to teach it. I love when students teach it. Teach it to your wall, teach it to your dog, teach it to a family member. Get a whiteboard, get a poster board, write it out and teach the material. If you can explain it, you'll retain it. So yeah, that's kind of one of my top things. And also you need to be able to identify patient safety, right? What is a patient safety issue? Again, I go over all of this in my course, but that's kind of like the main grasps. You have to be able to understand like what's going to kill your patient, what's going to harm your patient. That's what you need to figure out. And a lot of times you might not even need to know the medication in order to answer that question. So I also just posted a video on my page about how to break down NCLEX style questions, like going over the context of the question and then the core of the question as well. So that's also something you can check out. All right, guys, I'll see everyone maybe this weekend if I get a chance to go live, but for sure Monday at 8 p.m. I will see you guys next week. Thank you, everyone, for joining.